This slide is showing you societal factors. These are factors that influence the use of research. One of those is, of course, the rising cost of healthcare. In 2008, 15% of the population was over 65 years of age, and about 45 million Americans do not have health insurance. In 2003, healthcare costs totaled $1.7 trillion, and healthcare costs as a percentage of the GDP were about 15.3%. Employee-sponsored health insurance costs have risen at least let me start that over again. Good Lord. Employee-sponsored health insurance costs have risen at a rate 5 times faster than wages. Think about that for a minute. Quality improvement initiatives. These comes from your National Quality Forum. We can see the 30 measures in healthcare organizations that it can take to improve quality. We also have some other organizations such as the Agency on Healthcare Research and Quality and the National Database of Nursing Quality Indicators. There's union-based repository of quality indicators that are designed to assist hospitals to make improvements in quality nursing, such as ANCC, American Nurses Credentialing Center, which is the magnet program. And here's some more of those significant supporters and programs. Please feel free to go through and review this slide. Here's some of the latest type of research that's being used in nursing today. This slide illustrates key points about the application of research to practice. The NIH roadmap is designed to facilitate the translation of research into practice. Some decisions should not be based on the results of quantitative data alone, but need to also be integrated with data from qualitative research to be applied at a particular practice situation. The quality of care and the quality of outcomes of the care can be dramatically improved with the implementation of evidence-based practice. Requirements for the development of this evidence-based practice include a clearly written clinical question, that very thorough search for literature, review of single studies, analysis, critical appraised topics. You have your systematic reviews and clinical guidelines. Appraising the evidence and then placing evidence in the context of either patient, family, and or community values. Research utilization is an approach that's going to involve reading the research and then examining it for applicability to practice. Nurses have been leaders in research utilization with a number of early projects, and you can see some of these in Table 20-1 in your textbook. Several of the early research models have been adapted to reflect the transition to evidence-based practice. And so you can see an example of a model that's been updated to include evidence-based practice in the STETLER model in 2001, and this is illustrated in Figure 20-1. Go ahead and look over this slide. This slide illustrates the definition of evidence-based practice. A key point is this distinction between research utilization, which is going to focus on using a particular research finding in practice, and evidence-based practice, where the focus is solving a clinical problem with a research-based solution. A second key point is to emphasize that evidence-based practice includes consideration of patients' preferences. It also needs to be noted that when patient preferences are discussed, it's often in context of making choices about specific treatments. Many times in certain settings, nurses would assume that patients want to receive the best care possible. An example is the ventilator-associated pneumonia. It would be assumed that the patient preference is to receive the standard of care that would prevent this serious complication. This slide illustrates exemplars of research where nurses have made considerable progress in the improvement of nursing practice. You have preoperative teaching, pain management that's been out there, assessment of children's behaviors, fall preventions, which has actually been seen across the country, and guidelines related to falls prevention, pressure ulcer risk detections, incontinence care, family-centered care in the intensive care. So these are just some of the areas of practice improvements. Here we see the definition of translation science. Key points are that government and private agencies are placing increasing emphasis on translation science. And some of those areas are the Agency of Healthcare Research and Quality, your NIH roadmap, your Leapfrog group. This is the group consisting of organizations that buy healthcare to foster the implementation of initiatives that are designed to improve healthcare safety and quality. The Institute of Healthcare Improvement, which is an organization designed to improve health by advancing quality and the value of healthcare. You also have translation science is also known as an emerging field. Nurses have done work in this area, but it is an area that is just starting to get some attention by a lot of funders. Okay, I'm going to let you go ahead and read this slide. I don't know if you remember seeing this when we talked a little bit and introduced evidence-based practice back in your first semester, but this is the first step in evidence-based practice. This is asking the right question. Strategies to facilitate learning include having the class split into groups and think about some different things. So let's split up in some groups and think about this. When we're looking at this slide, students, you may want to find information on the best model of nursing care delivery, and it may be necessary to refocus your efforts for searchable questions. And so now you have to think about what would be the right question, and you have to come from a case management approach. You might want to ask some common types of clinical problems they encounter on their clinical units, or the types of clinical problems that someone may find to be the most challenging. Once you've identified a problem, it may be helpful to validate the importance of the problem with other colleagues or staff members on the clinical units. Okay, go ahead and look over this slide. And then we get to quality improvement. And again, this is always looking at how things are being done and what are the outcomes and how can we improve those outcomes. Here's some examples of some of the nurse-sensitive outcomes that we think about when we want to improve quality of nursing care. And on the other end, we have the patient-centered outcomes and some of their focuses. This here is known as the knowledge stage. Where do we get our information? And so they do have a list here of where we do get our information. And then you might want to think about in the future subscribing to a nursing research journal or subscribing to a clinical practice journal. Looking at different research, making sure that you attend conferences, listening to media reports on nursing research. You can start to access now or once you get out into practice. Maybe it depends on where you're going to be practicing and meaning which units that you're on and what would be more of your specialty. The persuasion stage, here's some key elements about the persuasion stage. And so informal communication networks. One of the things that you can do is networking with other nurses, other facilities and units, gathering information and sharing information. What are they using? What are some changes and implementations that you have made, and so forth. And so some people are very open about, and most people are very open about sharing the latest information that they've gathered in some research that they have found. Then it's time to decide. And do we make this change or do we not? So you have to think about certain questions, such as what are factors that would facilitate the adoption of this innovation? What factors would make it difficult to adopt? Can anyone provide an example of when an innovation was tried and maybe rejected? Think about where you've worked, if you've worked in the clinical setting, or when you've been in clinical or with your instructors and you've been on a unit and have heard them talking about how they were thinking about trying something, and if it was rejected, why was it ejected? Or maybe why was it adopted and when did they adopt it? Then here's the stage for implementation. So applying it, you may be changing it a little bit to suit where it is that you're working. Maybe it's not exactly, doesn't fit in, but you can make it work. Or indirect application and modified according to the needs and values of the staff, not really towards the environment, but toward the staff themselves. The confirmation stage is really evaluation, making a decision. Do we keep this? Do we not? Or do we modify it? So it's just like the evaluation of a care plan. So again, here that we're going to review again about some things that we talked about when we talked about change, because when you do adopt an innovation, you're going to have a change. Just like we talked earlier, the previous week is talking about change and who's involved and how is it going to be accepted by or not accepted by. Here is STETLER'S research utilization model to facilitate evidence-based practice. And so these are the steps. You have your preparation, then you go into validation, your evaluation, decision making, the translation and the application of it, and then evaluating it after it's been put into practice. This model provides direction for individuals and members of a group. It can be readily applied by nurse managers in a clinical setting, and it can be compared and contrasted with the steps of both scientific methods and the nursing process. And here are some of the steps that are taken when evidence-based is to be put into practice. Here's some individual strategies for evidence-based practice. And again, identify challenges in providing the care, ask questions about your agency's practices, and ask for the evidence underlying for those practices. Where did they get that? Where did it come from? Was it part of evidence-based practice or something that I've always done, and maybe there's some way it can be improved? Sometimes we want to use evidence-based practice and make changes, but sometimes we may lack funding, maybe not have enough experienced personnel. Maybe we don't have enough knowledge or information about the nursing research. And do we have the time to do it? Here's some organizational strategies, again, making sure you partner up. And sometimes the researchers might be fellow nurses on your unit. Also to make sure you have the key people in place, that you have support for your research. You have an area where you can do the research. And what are the expectations and what are the needs for you to conduct this new evidence-based practice. Lastly is the strategies for nurse leaders and managers. And so again, making sure that we have the right people paired up together and what teams are needed for the collaboration. Making sure that once we join in with different networks and that we establish a new policy, that it's out there, and then that we promote it and once we promote it and we've practiced it and we see that it is a success, then you want to definitely get that out, and so you would then publicize it.